commencement of every shift, it is your responsibility to ensure that you are familiar with the clinical environment that you're working in and the various types of equipment. For airway management, this may include checking the oxygen and suction, ensuring that there are various sizes of Goodell's available, that a bag and mask or air viva is present, and a pocket mask if available, and the location and contents of the resuscitation trolley. Let's watch what happens as our nurse goes to introduce herself to our patient. The nurse can see that something is wrong, and as she approaches the patient, she is assessing for danger.
Can you hear me? Can I have some help in here, please? John, can you hear me? John. John? John, squeeze my hand.
Remember, it is important to continue interacting with your patient even if there is no response. With help on hand, the patient is put in the recovery position. When assessing your patient's airway, firstly check for visible signs of obstruction, and in this case, we can see that our patient is obstructed with vomit. You will need to familiarise yourself with the signs of a compromised airway. If your patient is able to talk, then their airway is, by default, patent. Suctioning is indicated for patients with any occlusion. Remove loose-fitting dentures. We can see with 2 nurses that the patient is assessed and suctioned on their side. However, if you are on your own, simply turn the patient's head to the side to suction and assess their airway. Open the patient's airway using a jaw thrust or head tilt while the patient is on their back. Remember that the jaw thrust is indicated in patients with a suspected spinal cord injury. A Goodell's airway is used to help maintain a patient's airway. It would only be used in an unconscious patient or one without a gag reflex. Firstly, you will need to select the appropriate size Goodell's for your patient. Start by inserting the Goodell into the oral cavity with the end pointing upwards towards the roof of the patient's mouth. Once it is past the junction between the hard and the soft palates, rotate the airway 180 degrees and advance the Goodell's until it sits over the posterior wall of the pharynx and the flattened reinforced section sits between the patient's teeth. If the patient begins to gag or cough, make sure you remove the Goodell's immediately. When assessing the patient's breathing, look, listen and feel for about 10 seconds, assessing their respiratory rate and also their oxygen saturation level. The nurse then applies the non-rebreather mask, as this provides a higher concentration of oxygen as is needed for the critically ill patient. There are a variety of oxygen masks available. Assess your patient and decide which is most appropriate for them. The nurse ensures that the reservoir of the non-rebreather oxygen mask fills with oxygen before applying it to the patient. After you have stabilised the airway and ensured that your patient is breathing, remember to assess their circulation.
It's okay, John. We're just going to put you on your side. Arm out. Leg up.
Our patient is still unconscious, so we can see the nurses placing him in the recovery position and one of them stays with him at all times.
And then put your rail up.
After keeping the patient comfortable and attending to his personal hygiene, the nursing staff continually reassess the patient's condition, observing for any further deterioration. If your patient stops breathing, call for help. Turn the patient onto their back. Give 2 quick breaths if it was not witnessed, otherwise maintain their respiratory rate at approximately 12 breaths per minute. Breaths may be administered to the patient by expired air resuscitation, using for example a pocket mask, or by positive pressure ventilation, using a bag and mask or air viva. It depends on the equipment that is available and the number of staff available to assist. Let's watch our nurses put these skills into action as the patient's condition deteriorates.
Can I have some help with you, please?
Do you remember what to do if the patient vomits again? That's right. Remove the Goodell's and turn their head to the side, suctioning the oral cavity. When completing any nursing skill, it is important that we ensure that our patient is comfortable. Make sure you attend to your hand hygiene, disposing of any personal protective equipment or gloves. Raise the side rails or lower the bed as necessary, and make sure the brakes are on. Documentation is incredibly important. And ensure that you clean, replace and dispose of all equipment, making sure the resuscitation trolley is restocked.